Today's FAQ is going to look at two questions. When do you think things are going to turn around, and what are you watching for as cues to that turnaround? There are a lot of opinions out there, and we are drowning in opinions. And so as we kind of cut through all of that, what are we actually doing for our planning? We're looking at two phases as far as when we think things are going to turn around. The first one we have an answer to, July. If you look at the rest of the countries that have gone before the U.S. economy, you'll see this is about a 3-month hit in terms of the intense things before the economic bottom hits. And so for the U.S., depending on the region, that's end of May and through June, and probably a beginning towards a slow roll towards recovery in July. So we're planning on July as the first answer to that question. The second answer is about the rapid acceleration phase, this place where the economic pent-up demand comes online and really see some rapid acceleration. We don't know when that's going to happen. We think it's going to be medically dependent. And so what we're looking for there is really a treatment. So when a treatment that's safe and effective is on the horizon, we think that's going to be the green light for that kind of rapid economic expansion. We don't think it's going to be a vaccine. We think just with the treatment that the economy will take that as a green light. How does that translate into our planning, which is something that might be helpful to you? What we are planning on specifically is winding down some of the internal projects that we're doing this time in July. And so we're planning to have capacity available for this July ramp up. And then secondly, we are refining our bigger plans. So we're looking at a product launch, we're looking at investment in some new practices, things like that. And we're refining all those plans, and we're waiting on the investment for those plans, kind of dependent on that medical solution. And then the second question is, what are you watching for cues to the turnaround time? So we actually have a unique visibility in that we're a small company, but we're international. So the US is our largest market, Latin America is our second largest, and Europe is our third largest market. So we are monitoring at the country level, and of course we're dealing with each of those governments where we have legal entities and things like that. But what we found is that really the country level isn't that helpful. What's more helpful is to look at the industry level. So industries are being impacted in different ways, and so we think that the recovery is going to be uneven. So we're monitoring that to figure out where we put our sales efforts in, probably industry-wise. But the other way that we're monitoring is based on our practices. So let me give you a quick rundown of our practices. So in our augmented reality and virtual reality practice, that has actually accelerated during the time, so we expect that to just continue to grow. We're ramping up, we're doing training, we're adding capacity there. Our user experience practice remains steady and continue to grow, nothing spectacular, but we expect that to kind of tick up starting in that July timeframe like I was talking about. The next two, the development work and our talent services business, those two we have seen in past do really well when we have the unique circumstance in the US market where we have demand begin to ramp up, but large corporate clients still have hiring freezes. And I expect that to be happening in the latter half of 2020. So we expect a growth in those two practices. The last two practices I really don't know about. They are our branding work and our insights and research work. Those two in past downturns have been affected because that's a place where large companies often cut. However, this is a unique downturn. It's one that's medically driven versus economically driven. And we're seeing some signs from some of our clients that they are savvy now and understand that branding and communication are actually more important during downturns rather than less. So those two we don't really have, we are monitoring, but we really don't have a prediction on those two. We're trying to be open and share with you and let you know what we're doing internally to get through this. I'm interested in what you're doing as well. And of course, our primary thought is first for your physical safety and emotional health during this time. But from a business and planning perspective, if there's something that we can do to help, please reach out. Thanks a lot.